Which one? Albuterol? Okay. Dry? Mm-hmm. Did they discharge you with that albuterol or anything like that? Mm-hmm. I know, I can only imagine. Was that this weekend?
What's that?
About you taking Annie to urgent care this weekend
I
because
did
of the
take her to urgent care.
concern.
I was concerned that she might be getting pneumonia, and I wanted them to do a chest x-ray, which they did. And she's
I
not,
hear that cough,
Yeah.
that's not your normal
that's
cough.
why I ran her into urgent care, because it
Good.
wasn't getting any better.
And what did they,
Her lungs, apparently the x-ray was clear, and thank goodness, no.
so they gave you the albuterol?
So starting the following, I guess it was the day after that, we started her on a Z-Pack, 5-day.
Okay,
And apparently it's helping. Her coughing is less.
okay. Were you coughing with liquids when you got discharged from the hospital and you didn't have a voice? What did they tell you about that? What did they say? Were they the
They
ones?
said it would come back. They said, don't worry about it, it'll come back over 30.
Okay, and so then that's when you went to see Dr. Sugarman and he did your before and afters and sent you to me, correct? Okay. And in this time frame, obviously you've been walking around with a vocal cord that doesn't move.
Right.
Yeah. So when you eat or drink, do you cough? Okay. Okay, so, because when a vocal cord doesn't move, everybody focuses on the movement, but part of the sensitivity goes down too, so you're not as sensitive to things going down the wrong pipe till they get into your lungs and then you cough. So you can sometimes put you at risk for an aspiration event.
Really?
Yeah, that's why I was asking and trying to correlate it with the coughing, because is the coughing more related around meals, or is it coughing all the time, irrespective of?
The coughing is largely just for congestion.
Okay. All right.
You know, she's coughing up material.
Gotcha.
Yeah.
Okay. No, you can keep it on. So the way I do my exam, Annie, is through the mouth, not through the nose, like Dr. Sugarman did. Okay. We'll do it through the mouth. And it can sometimes trigger the gag reflex, so we'll just try and get you to overcome it, okay? Put this on so you can keep your clothes nice and clean. What's that? Oh, that's right. You look so stylish in my chair. Like you're a model for it. Okay, this is numbing spray. Do you have any allergies to numbing solutions? Okay, good. It tastes bad and it makes your throat go numb really fast, okay? Swallow. Okay, good. That's it. I'm gonna feel your neck here too, okay? Now, Dr. Bush, he's also an endocrinologist. Do you see him for anything endocrine related, or mainly as
No,
your primary
he's
care?
also our internist and our family doctor. And I'm a diabetic, so
I
Mike has been taking care of me for a long time.
Gotcha. Do you mind putting your collar down just a little bit, the turtleneck collar? Thanks. Just hold it down for a minute while I feel your neck there. Okay. Okay, swallow. And again. Okay, everything feels fine. You can put it back. this is my scope, it looks a little bit more intimidating, but you can see it hovers above the keyboard to shine a light down. Okay, and that's the same way it's gonna hover above your tongue to shine a light down in your throat and we can see your vocal cords.
I hear everything, go ahead, let me do it.
Hold this here. Yeah, just hold it, it's a microphone. Alright, you're gonna put your head forward like this, like you're smelling something in front of you, and you're gonna give me your tongue. Good, relax as you can. Good, say E, and again, E. Good, and again, E, 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 E. That's it, you did it. Good job.
Were those her vocal cords that I was
Yeah.
looking at?
Will
Oh,
you, let's try this again once more, just hold that a little tighter up against it. Yes, they were,
the white thing.
the white things, and you could see that the right of the screen, which is the left of her body, that it doesn't move. Yeah, we're gonna try that again here. Watch, I just wanna, now I saw that microphone was off for a minute. Now? Okay, tune it. Good, go ahead and say E, and again, E, E, say E, E, E. Good,
I can see it.
good job, you did fabulous with that.
Now I see where you're such a lousy singer. No,
He gets it now.
I get it. No.
All right, well, let me show you what this means, Annie. It's just a magnified version of the same image that Dr. Sugarman did for you. I'm gonna get you comfortable and remove this. You can keep the pillow if you want, if it's comfy. But let me show you what's what. And then I'll explain to you what the plan is here. Okay, so these are your vocal cords, these
Right.
white structures,
Got it.
okay? We all have two of them, they're like a V shape. You saw what your normal ones were doing before all this came about. When the left one of your body, which is the right of the screen, has stopped moving, the left one, or sorry, the left one,
Right.
is able to try and get to touch in the middle, but it can't really do that. It can't close that gap. So we call that a vocal cord paralysis on the left with a glottic gap. Glottis is another word for larynx or voice box.
Is that right?
Yeah, so a glottic gap. And through that gap, nothing but air escapes, the air from your lungs. So you're constantly short of breath. You feel like you have to stop in a sentence, and so it's easier to whisper than it is to try and actually get real sound out.
Mhm.
But I encourage you to try and get out of the whisper and just use whatever sound does come out.
You understand me?
And in the meantime, we don't have to have you live your life like this. Anytime we have an injury to the vocal cord joint and nerve, what happens is that we have to give that nerve a 1-year time frame
Ooh,
for it to come back on its own.
a year?
A year. But that doesn't mean that in 1 year we do nothing about how you sound.
Well, does it generally always come back?
There aren't any specific numbers because every situation is different.
But your experience?
So, in my experience is if it's from vocal cord intubation, that it does come back over time. There's no guarantees though. You know, I was not there. I was not the person. That's why I wanted to see what they said about them putting the breathing tube in, because there's multiple things that could have taken place to cause this. We don't know which one yours was, but I can tell you that you have to look at it like this not moving is like the electricity to it is off, okay? It's based on wiring of the nerve.
Mhm.
The nerve goes from the skull base through the neck. That's why it's put at risk when they do neck surgery to even to get to the spine. Through the neck. It wraps around the great vessels of the heart.
Really?
Yeah, it's got a long road. Then it comes back up into the neck and it plugs in. So
But it actually goes around the heart?
yep, around the vessels of the heart, around the aorta.
And there's a reason for that, obviously.
Yeah, it's the way our bodies are made anatomically in development, in embryologic development. But the reason I ask is that I've got plenty of people who show up in my practice that never had a breathing tube emergency. Right? They never had, and they have a vocal cord that doesn't move. So then the big question is, well, why? So yours is most likely iatrogenic, meaning it happened. That's a medical term for saying it happened because of the
manner in
injury.
which it was done.
But I can also tell you that until we let that nerve's wiring come back on its own, we'll never know if this is permanent. That's why we gotta pick a year from the date of your intubation. So February 28th or March 1st or whatever it was.
Mm-hmm.
And we really won't know until March 1st of next year if this is permanent for you or not.
Would there normally be a gradual realization of movement again?
Yes.
It's not just gonna happen overnight, but rather on a gradual basis.
Yeah, sometimes it happens on a gradual basis, sometimes it does happen overnight.
Oh, it
Sometimes
does.
somebody wakes up and they say, oh, well, my voice is better all of a
Mhm.
sudden.
I mean, I've had laryngitis myself at
Yeah,
different times.
very different, very different. This is a neurological thing.
Oh, gee, it doesn't mean it's gonna take a whole year.
It does not mean it's gonna take a whole, the earliest I've seen this come back, Annie, is I've seen it as early as 6 weeks, where 6
You heard
weeks
that?
later,
6 weeks,
people
maybe.
do just fine.
What do you-
But it's a bit of a waiting game.
Hmm.
And the take home to that is that there are things that we can do while we wait.
Okay, well,
So let's focus on that, because we
Okay.
can't hurry the clock up.
what can we do?
But we can certainly do things, and things that can improve the likelihood that your voice is gonna be better.
Okay. It's gonna come back one way or another, we'll see. A little more patience coming, you're usually the most patient person I know.
But obviously, you've been through a lot, so I can't
Yeah,
blame you
she's had a
for
hell of-
letting it out
She's had a hell of a time.
under
Yeah.
these circumstances. I can't blame you,
She's had a horrible month.
I bet.
Okay, okay.
Yes,
Does she go back to the gym and do?
Yes.
She's an athlete, she's very.
yeah, I can see, she certainly doesn't look her age, and she looks very fit, so.
75, she passes for a lot younger than that.
My goodness, well, it's all of that healthy working out and doing well, and, yeah, you can do
She's gonna
all
come
of
back,
that,
she's gonna
Annie.
be able to speak again.
Well, I'm gonna tell you how you're gonna get to sound much better, cause the next step after we talk about this is that while we hurry up and wait, the practice has changed. You know, talk to Dr. Sugarman. Years ago, people used to say, just give it time. Now that's changed. Now what we do is we use a filler injection to fill in this gap. Just like we use fillers everywhere else in our body for cosmetic reasons. People fill in their lips, they fill in their wrinkles, they fill in frown lines.
You gotta
So-
fill in the opening.
Yeah, you fill in, well, you don't put it in the opening. What you do is you put it behind the vocal cord, just like how I put that that pillow behind your back
Yeah,
to make you sit up straight. So I put a filler. My filler of choice is Restylane. I don't know if you've ever heard of it, but
Yeah, sure.
Restylane
You
people
use it for your face.
Yeah, exactly. It's hyaluronic acid. Restylane is just the brand name of it. And hyaluronic acid is found inside the vocal cords.
oh, really?
Yep. and we go ahead and we put a filler in there, and we plump that up,
So the gap is
so
less.
the gap is less, they can make contact and you can have something other than this as a voice.
Well, is that something that can be done very quickly?
Yeah, we can do that nowadays. I do it in the office, as a matter of fact. You don't need an anesthetic, you don't need to be put to sleep to do it.
Oh, great.
Yeah, so that's what we do. That's why Dr. Sugarman knew that I could help you. Yeah, so that's what we're
You'll
gonna,
have a little bit of a voice again.
yeah, something to yell at whoever you want to with.
Me, yeah, she yells at me.
Yeah,
Yeah, 'cause I'm hard of hearing. So for 40 years, she's been yelling at me,
Yeah.
that's okay.
good.
Okay,
So, we're gonna do that. We're gonna do that filler,
great.
okay? And we're gonna do the filler, and you're gonna do some voice therapy. And that's like physical therapy for the muscles of the throat. And the studies that I've been a part of that we've done this have shown that even if, worst case scenario, at 1 year mark, that joint never comes back to functioning, that vocal cord doesn't function. If that's the worst case scenario, those people who had a filler injection early on, like you're about to have, those folks do much better in never needing anything else permanently.
Really?
There's a memory from the brain to the throat that when you fill this up and they make some contact, even when the filler wears off, because if you're familiar with fillers, you know that they don't stick around forever. So when the filler wears off, the vocal cords then have a memory, just like if I made you sit with that pillow behind your, if you don't sit with a pillow, you're sitting in the chair like this, just like that slouched cord. And then I put the pillow and you sit up straight, and then you're closer to the functioning cord. And after 3 months, I take the pillow away, just like the filler would go away after 3 months. And guess what? Some people, they still remember to sit up straight, even without the filler there. So that's where the physical therapy exercises come in helpful, because they help you strengthen all the other muscles. So there's definitely a plan. And I've seen it all. I've seen it from people who have gotten the injection, and a week later their voice totally comes back to normal because it was enough to trigger that. I've seen
really?
it. Well, I've seen it. Doesn't mean it happens to everybody. I've seen it where we've had to do a filler every 3 months till the 1 year mark. That's 4 fillers, but it got us to the 1 year mark, and then the person was happy enough with his voice that he never needed permanent surgery.
When you say 1 year, when you say 1 year, I assume you're saying that's the worst case scenario.
Yeah.
So in other words,
If
sometime between today and a year, it could come back.
Anything can happen.
Anything can happen,
Yeah.
so it'd probably come back before that.
But it won't get worse than this. This is about as bad as you're gonna see it, just FYI. Today we're looking at it at the worst. What our goal is, in a perfect world, is that this joint and that wiring starts working again, okay? Now, the other thing to note is, while, as I was saying earlier, there's very little doubt in my mind that putting a breathing tube in an emergency situation could have caused this, I like to be sure, and I like to know that it's not that it's just a coincidence that you had a weak nerve to begin with, because somewhere along this wiring there was a weakness, and putting a breathing tube in there just was like the last drop. And so, in order for me to be sure, I usually get patients a CAT scan to look at that nerve and make sure there's nothing in its path that could have predisposed you to having this, and it was only a matter of time before this would have come up on its own anyways. Does that make sense?
But if you, okay, but the result of a CAT scan, let's say it showed that there was something in the back, how would that ultimately affect the outcome that we're talking about?
Yeah, well, things that could be in the way would be a growth on the thyroid, something with the heart, something within the neck. And if we find that's there, then we take care of that, because we know that's impacting. The likelihood of us finding something like that is low, But I don't want you to be in the 1% where we miss something and we just all assume,
No,
oh
she
gosh,
just-
it was.
She just got done being the 1%
Yeah.
with Alyssa Pearl.
Yeah, so we don't need another
No,
surprise, so
yeah.
that's why I urge you to, let's just dot our i's and cross our t's
Well,
and
let's set
get
up a
that
CAT scan.
CT scan.
I think I've had one before. Doesn't matter.
Doesn't matter, this is of the neck, it's a dedicated scan of the neck with a
There's
fine,
nothing to the CT
cut-
scan.
yeah.
I just did one. It's,
yeah,
nothing.
and it'll just give us peace of mind more than anything.
Yeah.
And we'll book you for the filler injection. It's done through the mouth, just like how we did this video.
Oh, so it's not something you could do today, no?
I can't do it today. The reason being is that I don't stock any of the fillers at Cedars because I'm not private practice, I'm Cedars. They have to come from the Cedars pharmacy. And so we have to put in an order and, I mean, but we may be able to do it as early as next week or the week after.
Yeah, the sooner the better.
Yeah, I hear you. We'll do it as fast as we can.
Yeah, I think once she sees that she can speak reasonably, she won't be quite as unhappy as she is right now.
I can't blame you. And in the meantime, I do want, it's a 4:45, but I was gonna say, let me have you start working with one of the speech therapists. Get the ball rolling. That's stuff you can do. If you're a physically fit woman, like I see that you are,
She is.
then you are gonna adhere really well to doing exercises with the muscles of the throat. Okay?
She's very self-disciplined, very.
Excellent.
And she's also in the Guinness Book of Records.
Really? For what?
She's the world's oldest rope skipper in jump roping on the planet, and it's, she just got in.
Wow, congratulations.
Yeah, she
I grew up
competed. Yeah.
skipping rope, but nowhere to this level, I'm sure.
Well, yeah, she's amazing.
That's
The
awesome.
whole world.
Wow. How many rope skips? Is it like in a minute or in a?
Obviously, it's only a minute, but you have to qualify for it. And I'm the oldest one. They never had anybody.
Oh, wow.
Excited about that.
That is exciting. Are you getting an award? Do you have anything coming up?
Oh, she's got a certificate or something, yeah.
Oh,
In
okay.
fact, she just got notification a couple days, was it 2 days ago that Guinness sent us the notification. So she's got a pamphlet and it's got, it's a
Wow.
big deal.
That is a big deal. Congratulations.
Yeah, I'm very proud of that. It's an accomplishment.
I'm sure it's on a list of many.
Yeah.
So,
Yeah, that's
so,
good.
I can tell here, we've got somebody who's got all the setup for good things happening from here on out. And I think you've passed the test of life with bad things happening.
Yeah.